Thank you. I'm delighted to be here. This is not my usual venue, and I've enjoyed it. I just want to say that it's been really interesting to listen to the discussions and to try to insert the life I've led at the state and federal level into some of these discussions. So my charge today is to try to do three things in 15 minutes. The first thing is to start to talk a little bit about this term policymaker. I hear it, we've heard it for 2 days, but let's try to think about what that means and who these people really are. The second and probably biggest piece of the work is to give you a kind of inside baseball look at what it means at the state level to have to grapple with some big policy issue, and then some just recommendations that I have. So let's take a look at this business of policymakers. And typically we think about the folks who make laws and fund programs and the legislators. But I also think it's tremendously important to think about what I'm going to call program specialists. These are folks like Linda and I in my other life, the folks in the executive branch who actually can write legislation and who have to implement the programs, who have to make sure that they're doing what they are supposed to be doing. And then I want us to really think also about what I'm going to call, for the sake of this discussion, policy influencers. These are advocates and stakeholders, and they are a powerful force, can be a powerful force on legislators and program specialists, as Linda and I know. And they are tremendously important in their support or opposition to legislation and regulation. So it's not just thinking about, I don't want you to just think about people in a legislature passing laws. There are a lot of folks going on who are really interested in making policy and informing these issues. So my job is to give you a sense of what goes on when there's a real policy decision to make. And so before federal service, I was the Assistant Commissioner for Early Childhood in New Jersey. And I'm just going to talk you through what happens in a state when there are big issues to make and we don't have Steve to help us out. So it is 2006, 2007. New Jersey is operating a court-ordered high-quality preschool program, and the charge is to provide all 3- and 4-year-olds in 31 of the poorest districts with a full-day, full-year program. This is a very important issue here in New Jersey. We have the districts such as the regular cast of characters you would expect, Camden, Newark, Trenton, but also smaller districts like Garfield and Red Bank. And they have been, for some time, not receiving the funds they thought were necessary to provide a thorough and efficient education. And so the court decided we will give them extra funds, but we will also put in full-day preschool as a kind of remedy to whole school reform. Now, this is after those advocates that I talked about, those policy influences, had worked very, very hard to make sure that preschool was a part of this. So it's, again, 2006, 2007. They've had 2 governors who were very supportive of this issue going forward. The governor now wants to expand preschool because while 31 districts have this universal preschool, there are over 600 school districts in New Jersey, and those guys don't. So the governor says, there are kids all over, we have to do this, we have to do a better job. The Commissioner of Education is under pressure to have a new school funding formula, and she also wants to be able to expand the program as the governor wants, but also wants to be able to change the way we fund these programs on an annual basis. Every year, these 31 districts plan budgets, and there are many, many programs in the districts. School-based programs, Head Start, private providers, and they each start from zero and bill their budgets every year with state staff going through these things in a torturous way and then going to court because they always sue you. So it is that environment in which we now are looking in 2006 and 2007 at how to do this. And so you look at some of the components, and these are just the major components of this Abbott preschool program. It's full day. There's a maximum of 15 children per class. Teachers have to have a BA and a P3 certification. We have master teachers. These are teachers who have at least 5 to 7 years of experience, and they are working with these classroom teachers, the teachers who have the BAs, helping them to really have quality in their programs. We have family workers because these are districts that have a lot of stressors in the environment, and we have to do something. So now the question is, how do we scale up? How do we scale this program up so that we can reach children, high-need children, in 600 school districts. And how much is this going to cost? And will we be able to get the same kinds of impacts for kids when we scale up as we can now? Well, what is it going to cost is a big issue. You see the numbers, people get very nervous. And so the question is, well, do we really need these family workers? What exactly is this 15 max? What's the difference between 15 and 17? Do we have data that says 17 kids in a class is really going to make everything terrible when we have 15? Does it matter? And so all of these questions are floating around. Do the teachers have to have a BA right away? What can we do? How do we find ways to take pieces of the multiple components of this program and maybe say that's not really essential to getting gains, but it would be something we can maybe bring back after we've spread out a bit more. And it is this, I think, even now, as we have more state and federal focus on early childhood, this tension between expanding programs, having more children in seats, and making sure that it is a high-quality program that is going to give you the impacts you need. So this, I would like to tell you that we had this wonderful look at all the data that was possible, and we figured out a way, based on all the research we had, that we could make these decisions. In fact, we had legislators going a little hysterical because they didn't know how they were going to pay for this, the governor saying we're going to do it, and we had those policy influencers threatening court action every day and saying you can't take out this and you can't take out that. The ultimate decision was to keep every single component of the program in that per pupil funding formula. So now those districts know how much they get per child, and it varies because basically teacher salaries was the biggest driver of costs, and we were paying teachers at parity with public school teachers, so all the Head Start people and the private providers were paid the same as school. But each district in New Jersey negotiates on its own with the union, so each district had a different, it's a very complicated place to live. So we look at this, and I guess my thinking is that these interventions are very complex. They're made up of multiple components. It's not just we're going to go and do one thing. And I think as you think about the cost-benefit of this work, to understand that these programs are built on trying to figure out what will have an impact on the health and social and emotional and cognitive outcomes for children. These are broad-based interventions. And so to what extent do these components function individually? To what extent do we see them functioning in some interrelated way that we don't know about? And that was our big question. If we take away the master teachers, because we've said these teachers have to have, the classroom teachers have to have a BA and a P3 certification. Shouldn't they be able to do this on their own? And yet we had to come back to the reality in our field that teacher preparation in general is problematic in this country. In early childhood, it is very, very problematic. And so even with a BA, we had teachers that we knew would not be able to function without a lot of support and get the kinds of outcomes we wanted. And so those master teachers, we were terrified to take them away. We didn't have data to tell us what's the contribution that a master teacher makes. As we look back, I'm going to go back here. We looked at family workers. We had no data to say what's the contribution that a family worker makes. And is there more of a contribution in a place like Camden than in a place like Garfield? Because these districts, while they were all, in theory, housing large populations of low-income children, the economics of the districts themselves varied tremendously. And the family needs and stressors vary tremendously. So the notion of what is really critical, what is important, what can go and just last for a little while was very problematic for us to figure out. And so these discussions about what will keep us getting the best impact, getting high results for our money, are discussions that, while in a very sort of theoretical way, I think are tremendously important. I want you to understand that they are made under incredible pressure. Incredible pressure to do it sometimes quickly, to do it and do it in the face of opposition that is very, very strong. And so you are sometimes inclined to say things that you might not have said in calmer situations. And so there are times when folks will absolutely know that the promises they're making are not entirely borne out by the research for everybody, but there is such opposition that there is really, really a strong pull to do whatever you need to do to make this happen. And you see it, you see it. I speak honestly to you because I think that is the truth as I know it and I've seen it. So everybody is intending to do good things. Everybody wants wonderful things to happen. They want stronger outcomes for children, but how you pay for it, and how you decide what can be seen in the time frame of a particular administration so that you can actually say we did something important. These are hard things. It is not easy. It is complicated. It is not easy. And we don't always know the right questions to ask. And so I would call for greater conversation between policymakers and researchers because there is hardly ever that conversation. It is, give me some research now that will make this happen. You have an hour. And I've gotten that call. You have an hour. I need it now. Did you know yesterday or last week? That's not a question you can ask. But it is what happens. And for the researchers, it's what are the questions? What are the stressors? What are the things these folks need to be able to do and say to be able to make things happen? What's the argument? You know, when you have a legislator come to you and say, I don't know how to convince my colleagues about this. Give me some language that I can use on the floor. That's a language, that's something you can work with. But you've also got the advocates out there, and sometimes in their zest and fervor to do the right thing, they're also saying things that are not quite right. So the question, you know, the question of the social sciences always remains, what works for whom, under what circumstances? And if we have things that are working, how do we then scale them up to something better? All right, I have a few suggestions here. This control group business is absolutely critical. I think Becca mentioned yesterday, the world is different. And so think about Head Start, starting in the 1960s. It was the only game in town. It was that summer, that little summer program, that 6 weeks that was going to fix the achievement gap. We've learned a lot since then. 6 weeks isn't going to do it. We don't know that 2 years is going to do it. We do what we can. But there are other options out there. And so what is the control group getting? Where are they? It's not just did they come back and get the treatment, but they're out there doing something else that we don't understand. And we can't really look at the results of our interventions unless we truly understand where those children have been, everybody's been. So that's a real issue that I think we need to be very honest about talking about and making sure we understand fully. And then I just would like folks to help us prepare and remind legislators to expect variations in program quality. Somehow, a program is a program. And so you will hear folks talk about Head Start as though it is a monolithic program. It is a program that has lots of different kinds of interventions. They have a set of standards, and so there are overarching things that are the same. But nobody's going to tell you the quality is absolutely the same across these programs. And no one will tell you that as they start these programs, especially in the initial stages of implementation. And so there is this push to fund and then test the next day. We've funded the program, now we should have really good results, and we want to test and get some results. There is very little notion of something happening in the middle, and very little ability to really want to come to terms with the fact that this intervention is happening because we have a dismal state of affairs. That we are funding this work because children are not getting high quality, because teachers really need a lot of support, because there is a high need out there. And so I've had legislators argue with me that they didn't want to pay for professional development. Why would we do that? Just get teachers who know what they're doing, and let's just do the program and get the kids doing better. which shows a complete lack of understanding of what's going on in the field. But that is a push. We pay, we test, and now we've got to really see results. And so somehow, if we can continue to support this notion of looking to see what we have, getting baseline data before we start looking for effects, that would be helpful. And then I think the notion of standardizing the presentation of data is tremendously important. It's not just that it gives people a common language, which it does, but it also gives folks a common conceptual framework. It guides their thinking so that they're asking the same set of questions and they don't go off all over the place with each or forget things. And so I would really think that if we could think about the ways in which we can have a common way to present information that the policymakers need, and we might also think about asking them what they think is helpful, we would have policymakers who could start to ask more informed questions because they truly don't know what to ask. So what I wanted to present to you, and I hope I have, is a sense that folks are trying to do the right thing. They're doing it under extraordinary pressure, and that they are doing it in the midst of very complex interventions that are hard to figure out. So my time's up. Thank you.